So this is my second study presented today about prostate cancer. As you can see, prostate cancer is a major concern about men. And let me give you a little bit of background about prostate cancer in the current days, especially in the United States. As you all know, prostate cancer is a disease of aging men. And most of the men have their cancer diagnosed after age 70. And many men died around close to 80. So it is a disease of aging men. And yesterday I went to a wonderful session about aging and cancer. So we have to keep in mind of that. And second point is widespread PSA screening in this country identifies so many prostate cancer in the early stage and push the the cause of disease, on average about 8 years earlier than the natural occurrence by clinical symptoms. So by saying that, given so many prostate cancer have been identified or detected by PSA screening, and that left many of these cancers could be non-harmful if left without treatment. So the key question is, what risk factor could be identified to contribute to fatal prostate cancer that ultimately will kill these guys? On the other hand, we have also to keep in mind about cause of other deaths, given these the old men with so many comorbidities. So over the past 10 years, we have been shifting to identify risk factors for whether you have instant cancer versus fatal cancer. So the first two risk factors we looked at obesity and cigarette smoking. As you may or may not know, obesity and cigarette smoking are not related to risk of instant cancer of prostate, but they have been implicated in prostate cancer mortality in multiple prospective cohort studies. However, data not are lacking about simultaneously looking at those two factors simultaneously, and also to counting for competing risk as have been loaded. And as shown in this chart, you can see so we look at these questions in the Physicians' Health Study, a long-term cohort study of over 22,000 men, and followed for up to 27 years old. As you can see from this chart, among 2,700 men diagnosed with prostate cancer over 27 years, a third of them died. And among these men, only a third of the deaths are attributed to prostate cancer itself. So a majority of them died of other causes. So that's the reason we have to take into account competing risk when we're looking at risk factors for fatal prostate cancer. So this chart shows the relationship between prediagnostic BMI and risk of deaths for all cause of deaths, as well as cause-specific deaths due to prostate cancer, cardiovascular disease, and other causes. As shown here, clearly BMI was significantly associated with future fatal risk of prostate cancer deaths that mainly accounts for the overall all cause of mortality. And this accounted for smoking history. And this slide shows, in the similar fashion, that smoking was associated with increased risk of dying of all-cause mortality, as well as each individual groups of causes, prostate cancer, cardiovascular disease, and other causes. So that clearly show tobacco smoking is a risk factor for all-cause mortality, including prostate cancer. So when we combine these two risk factors to see, because in this population, over 40% were past smokers, in this case, only like less than 10% are current smokers. So our question is whether BMI and smoking jointly could influence risk of fatal prostate cancer, as shown here on the left-hand panel. We can see never smokers and past smokers, the first two lines, and if they're overweight, especially obese, they have very high increased risk of fatal prostate cancer. This is something new, actually, and needs to be further confirmed. And also, we don't know what's the underlying potential mechanism and needs to be further followed and investigated. And on the other chart shows non-prostate cancer specific mortality. And as we can see, current smokers, regardless of their BMI, risk factors for non-prostate cancer mortality. And these two charts in parallel clearly show the competing risk. If they die of one causes, they may not less likely, die of other things. So, in summary, among these prostate cancer patients, only a fraction died of the cancer, and majority died of other causes. That reflects the picture of the whole the national figure. Elevated BMI and tobacco use predispose men to a significantly higher risk of prostate cancer-specific and all-cause mortality. Compared to lean non-smokers, obese past smokers had the highest risk of prostate cancer mortality. Current smokers had significantly elevated risk of dying of non-prostate cancer as well as prostate cancer diseases, regardless of their BMI. So our finding add new evidence that both obesity and tobacco use are could be major risk factors for fatal prostate cancer. As Ernest alluded, these are observational studies. So finally, these data underscore the need of implement effective preventive strategies in weight control and reducing tobacco use in both healthy men as well as prostate cancer patients.